A woman's circadian rhythm often falls short of a 24-hour period by about 6 minutes, making them more likely to be slightly out of sync with the day. Conversely, men are more prone to being night owls. However, women tend to perform better during periods of sleep deprivation. During exercise, women primarily use fat as fuel, while men rely more on carbohydrates. Men crave companionship just as much as women and typically find being alone without a partner for extended periods challenging. Their typically higher levels of testosterone often equip men with excellent social skills, contributing to their assertiveness and sociability. Men are often inclined to prioritize their own desires, goals, and needs, placing themselves first in various situations. Independence is highly valued by men, and they generally dislike being instructed or micromanaged in any aspect of their lives. On average, adult females have 15 to 70 nanograms per deciliter (ING/dL) of testosterone, while adult males have about 270 to 1070 ING/dL. Men experience a 1% drop in testosterone levels every year after age 30, whereas women do not undergo this decline, but they do experience a decrease in estrogen levels after menopause. Men typically have more prominent Adam's apples due to larger voice boxes, resulting in protruding cartilage. Both men and women reach peak bone mass around age 30, after which they begin to lose bone density, with menopause accelerating this process in women. Consequently, women aged 51 to 70 require an additional 200 milligram of calcium per day compared to men of the same age, totaling 1,200 milligrams for women and 1,000 milligrams for men. Men generally have a higher daily calorie requirement than women due to factors such as greater muscle mass, height, and basal metabolic rate. Muscles burn more than double the calories compared to fat, pound for pound. Women typically carry about 10% more body fat, mostly in support of reproductive functions. This higher body fat is crucial, as excessively low levels can lead to menstrual irregularities. Women tend to store body fat in their hips and thighs, whereas men typically accumulate fat around their abdominal area. Due to differences in size, muscle mass, and calorie needs, men usually require diets higher in protein. Research indicates that men typically have lower resting heart rates than women, but women exhibit lower peak heart rates. Men's heart rates tend to increase more rapidly during exercise and return to normal more quickly afterward.